Welcome back to Zero World 2016. I'm David Temple, and there is so much to learn at this convention center. And these are some of the guys you're talking about. We're talking about ergonomics and workflow with the Dentsply Sirona treatment centers. First of all, welcome, gentlemen.
Thank you.
Hello.
Thank you.
We've got Thomas, Stephane, and Holger. And why don't we start with, I'm going to flash back 1 year.
Sure.
Vegas, back when it was pre-Dentsply Sirona, C30.
That's right.
And they rolled out the new treatment centers. It was like a new generation of treatment centers, right? And I remember thinking to myself, that's the most impressive thing I've ever seen. It was like they were going to roll out the latest sports car, the Lamborghini of treatment centers, right? Who knew it could be so sexy?
Absolutely. I mean,
Jump in it.
Still today, a year later, it still is.
Yeah.
Right? And ergonomics and workflow, it's a big part of it. It's not only sexy, like you mentioned. That's one thing that's evident when you look at it. But when you use it and when you work with it, you realize there's much more to it than just the sleekness of the design and
the magic is the workflow, right? That is the magic.
Yep.
It's not just about sitting in a chair and going, because you're minimizing distance and energy and all that, right? Which is ergonomics.
Mm-hmm. In workflows, yeah, absolutely.
Tell me about the workflow. Who wants to jump in on workflow?
Yeah.
I can jump in there.
Yeah.
So in general, the workflow starts in the sterilization and the centralized storage. And there you prepare all the tubs and trays and cassettes. And from this point, it's going on into the treatment center, into the room where you have your patient, and you set up everything there, right on time, what you need there, no clutter, clean, structured, and then the ergonomics starts in there.
Thomas, what do you like the most about it?
Yes, actually when it comes to the treatment and we speak about dental ergonomics, we have to speak about how we can put the head of the patient. Because our field of work is quite narrow, it's just the oral cavity. And it's not so easy to look inside. So, if you think about a dentist, he's always like rammed and tried to look in there. So Dentsply Sirona really makes neat treatment systems because of the headrest. It's a motorized headrest we have, for instance, in Teneo. And that means that every situation of your treatment, you just touch one switch on the bottom with your feet, and at a sudden, the headrest adjusts. That means I can leave my two hands on the patient. I don't have to put everything back and organize anything with my hands, no manual adjustment. It's just done by the motorized headrest. That means I'm always sitting straight, and I can look directly into the patient's mouth. And this maneuverable headrest is the guarantee for my health, for my back, and also for my economic success. Imagine if I fall out for half a year because my intervertebral discs are still out, that will be crazy for my office. So that is really something I appreciate, and which is the best thing actually about ergonomics, having a perfect working headrest. And altogether, we want a four-handed dentistry. I mean, four-handed dentistry means the work is going on. And the patient's experience is like everything is working together, everything fits. I mean, there's no awkward taking from the back, it's all over there. And my assistant on the other side, she also has with her two hands to work on the working field. So for me, it's easier to proceed. And she has her suction on the left, and on the right, she has the Kappler's egg, that's the variable table and the rear delivery. So everything is in reach, and it's just a real workflow, as we said.
A full integration.
It's interesting. When I stop and I think about it, my mind is flashing back to early years, and the chair and the system was always the exact same thing for dozens and dozens of years. And then all of a sudden it took somebody like Sirona, now Dentsply Sirona, to come along and go, let's change the way they do everything. Again, back to the reference of last year.
Yeah.
When I saw that come out, I'm like, oh my goodness.
This is actually something we've been doing for a very long time. And it's back to the early 80s where we have full integrated and digital system. And now we're at the level that, everybody should enjoy it and appreciate it. And if we go back to workflows from Thomas, efficient workflow saves you a lot of time. Imagine you see 10 patients a day and you save just 5 minutes per patient. It means you can see one more per day.
Right.
That's one more procedure. And that's the kind of thing that's hard to measure But whenever someone starts working and adopts that new workflow, they easily feel it, and then they got to change their schedules. But
Yeah,
other than that, it's just being more efficient.
sure.
Right?
It's always important to find a way that is better, safer, and faster from the workflow, from ergonomics. That's the main goal.
This may be an odd choice of questions, but who decides the finish?
Finish off.
The finish of the cabinetry, for instance. I mean,
First of all, the decision is made by the dentist, no
Okay.
question. But at the end, recommendations from us is what is for that specific area the best surface, the best color, and this is what is normally guiding it. You can have a black, a gray, whatever, but what we provide here with the white, which is timeless, so we not provide wood finish things, looks like for 5 years nice, and after that it looks like old stylish.
you mean harvest gold and avocado green is not hip anymore?
Maybe not, maybe not. So we provide a piece of art.
Right.
And looking at the treatment center, it's the same. It's this nice white, which is clean.
Right.
That's why also the cabinetry is white, looks clean.
Right.
And we're in a dental environment, so we should take care that it's clean and safe.
It's perceived, it's the perception of cleanliness as much as anything, right?
Yeah. When you walk in, you should just see that.
Assume it, yeah.
Yeah.
Yeah, and obviously there's some choices that we don't even touch.
Right.
Like accent colors or wall colors,
Camouflage.
camouflage, and these kind of things. This we leave to our customers, the dentist.
Yeah, can you see that, by the way? For all the hunters out there. What do you see as being the future? I mean, I know it's a hard question to ask, but we're asking a lot of folks that, you know, it was this for so many decades, it's now this, you're at the cutting, bleeding edge. What's next?
The future is now.
The future is now.
Yeah, absolutely.
I think what we can see already on Teneo and Intego, we have a lot of integration. I mean, if you think 20 years back on your desk, you had a phone, you had a fax, you had a big calculator. They were like this, you know.
Yeah.
And nowadays, you just take your iPhone or your smartphone, and everything's on there. That's all integrated. And we did that already on Teneo, but I think that Dentsply Sirona will continue with that. So we bring all in the 3D, the CEREC, and everything's going in, and the workflows will be even better in future. And the idea is that the treatment center knows what you want to do. So you don't have to deal so much around with maneuvering it. I mean, at the time where dental chair, that was called then, could go up and down and forward, backward, there were four switches, so no problem. But if you make a panel nowadays for all the function, it will be enormous. So the treatment center has to think, what do you want to do? And serves you only the few clicks to maneuver it. And I think that will continue. So it makes it easier for us to use, safer to use, and faster.
Sure. Excellent. Well, guys, thanks for taking time out of your busy schedule to talk with us.
Thank you.
Enjoy the rest of the show. Promises to be a big bang.
Absolutely.
All right.
Thank you very much.
Thank you.
We're going to take a short break, and we'll be back with more Zero World 2016 right after this.